Good day, viewers at home. I'd like to welcome you to the very first edition of the JCC Medical Interview Series. And this is a production of the medical team of the Redeemed Christian Church of God, Jubilee Christian Center here in Wolverhampton. My name is Oladi Ifayemi, and I'm not here alone today. I've got my colleague here with me.
One of the anchors for the program today. And like Nia said, thank you very much, Nia, for that. Like I said, it's a beginning of a new thing, a big thing, so to say. And I'm very sure that God will help us to sustain it with the best of our power and talent and everything we've got. Today, like I said earlier on, is going to be not just your normal routine interactive sessions, as we got two big fishes in the house today. So let me just quickly go through what we are going to be discussing today. We'll be talking about hypertension, and I know a lot of you are home there. You've got questions that you want to ask. What about hypertension? So today we've got two persons that will be dissecting and talking to you through what hypertension is. So to my left, I've got Dr. Somto Iguanugo.
Thank you, Kenny.
Who is a registrar and a GP practice at a GP practice in United Kingdom here. And also to the far left, have got Dr. Aminu. He's a registrar at the renal unit in New Cross Hospital here also in the United Kingdom. So today,
Thank you.
no, you're welcome. So today we're going to be making it very, very much interactive. Stay back and stay tuned to JCC, RCCG, Medical Team Interactive Session, the first of its kind, and it's going to continue. Lee, over to you.
Thank you for that introduction. According to the World Health Organization, hypertension, which also is elevated blood pressure, is a serious medical condition. It significantly affects the heart, the brain, the kidney, and other diseases. According to the World Health Organization, an estimated population about half of adults with hypertension are actually unaware about this condition, and that's something I find very tricky. So, and then it's said to be a major cause of premature death worldwide. Let me start with you, Dr. Somto. What is hypertension?
Thank you for that question, Eve. Very important question. Hypertension, which we also call high blood pressure, is when the pressure within the blood channels is unusually high. So it's an objective finding. So we use values to see what that pressure is. And so we say high blood pressure is when the blood pressure is equal or above 140/90 in a clinic visit, and then an average blood pressure reading at home of more than 135/85.
Thank you. Before I allow Kenny to ask his question, Aminu, Dr. Aminu, why do people have hypertension?
Yeah, thank you for that question. So, in majority of cases, the cause of hypertension is unknown, and usually that happens in people that have possible family history of high blood pressure, and usually in the older population. But in younger population, there might be other medical illnesses that have not been diagnosed, causing the person's blood pressure to be high. So in those particular kind of cases, you have to look for the cause of the high blood pressure. But by and large, usually the cause of hypertension is unknown.
All right, thank you very much, Dr. Somto. All right, you've actually said something very important about the benchmark, setting the benchmark for what the blood pressure, normal blood pressure should be. Now, the question I want to ask you is, now, assuming I have a blood pressure 140 and over 100, does this still mean it is normal? Then if it's not normal, how do I know? Am I supposed to have a feeling to really know that, my blood pressure is going high, is going low? What happens if it drops below 140/90? What is it called? What should we expect from that?
Yeah, I think this is where most persons tend to have the misunderstanding, because the blood pressure tends to change as the day goes by, which is why, like I said, it's an objective reading, but then it's not an objective reading that is just gotten once. So this is why when you go to a clinic, blood pressure or hypertension is said that to occur when the clinic blood pressure is equal or more than 140/90, but it doesn't stop there. and a home blood pressure reading, which is taken as an average for a certain number of days, is found to be more than 135/85, or what we call an ambulatory blood pressure monitoring, where blood pressure kit is kept in the arm for 24 hours and then they check the average is more than 135/85. So what you see is that it's not just a clinic reading. So many times people go to the clinics and it's high, but there are some persons that have what we call a white coat syndrome, where the blood pressure is high in the clinic, but it's very low at home. So this is why, to make a diagnosis of hypertension, it's a combination of a clinic reading and as well a home pressure reading, except it's excessively high.
So, sorry, Renee, if I quickly hijack this from you. So I know some of our listeners and viewers at home are already asking themselves the questions. I am 50 years and I have my blood pressure at 150/80. And I am also 16 years. Should I expect my blood pressure to be 140/90? And this takes us to, does it mean that blood pressures varies with age? And that is one question. And I am going to direct that question to Dr. Aminu anyways. And also, another question I want to ask, it's a popular belief that blood pressure increases in blacks. Is that true? So I've asked two questions, two-pronged question in one.
That's right. Thank you. So usually blood pressure increases with age. So you don't expect the blood pressure in someone that is a teenager to be the same thing with someone that is maybe in the mid-30s. But at the same time, it should still fall within the normal range. As you asked, someone that is 16-year-old that is having blood pressure of 140/90, that could still be termed as hypertension if the readings on several occasions actually that range or higher than that. The same thing with someone that is older. So the benchmark is 140, more than or equals to 140 over more than or equals to 90. So the same thing as you asked as well. So someone that is above 50 that has got blood pressure 150/80, that's high blood pressure as well if it's more than one reading. Going to your other question, you asked blacks are prone to having hypertension. That is true. And research has shown generally that blacks have what is called source-sensitive hypertension. And number one is the fact that the majority of our diet contains high amount of salt, and that is one of the reasons why it's commoner in blacks. Another thing is our genetic makeup is different from people of other ethnic background, and there are some these genes are actually also contributory. Other things that have been noticed are stress as well. It's been noticed that blacks go through a lot of stress, especially blacks that live in poor income communities. They go through a lot of stress. So this as well contributes to high blood pressure in black people compared to other people of ethnic background.
Thank you, Dr. Aminu. The problem is you've thrown up a lot of things that you just have to follow up on. So I've got 4 questions for you.
That's okay.
So my first question is, when we were talking earlier, you talked about genetic. From my understanding, it talks about family pattern. That's what genetic means.
Yes.
And it suggests that if a parent has hypertension, the children may have.
Yes.
Is it may or will?
So it's still may.
Okay.
Because other things come into play. It's just not genetics. You have to think about environmental factors that can also contribute to the person developing blood pressure, dietary factors and all those things also contribute. So it's not just one factor. Other factors have to contribute to it. It's just that people that have family history are at higher risk than people that don't have family history of high
So it's
blood pressure.
not always.
It's not always,
Okay,
yeah.
that's
It's
right.
not
Thank
always.
you. My second question is also why you were talking about black. You talked about salt and stress.
Yes.
Does it mean salt has a relationship with hypertension? 1. 2, stress. My thinking is hypertension is because people think a lot. Is that true? Is it because people think a lot that's why they have hypertension? So 2 questions. 1, salt. 2, is hypertension because of overthinking?
Yeah, so yes, salt intake, I mean, usually what is recommended is about 5 grams of salt in a day. But when you exceed this amount, or if you already have high blood pressure and your blood pressure is not well controlled, one of the things your doctors will tell you is to cut down on salt intake. Or if you already have some other medical illnesses that actually cause sodium, because sodium is what is inside salt, that will cause sodium to get retained in your body, and you are not, passing it out as you should. Then you need to cut down on salt intake. So, but for any average person, 5 grams is what is recommended. But you might have to become strict with some other group of patients regarding this. You also asked that. Sorry, I didn't.
Overthinking.
Yeah. So overthinking someone is not directly a cause of hypertension, but it can worsen someone's blood pressure if you're already hypertensive. It means one of the environmental factors that can contribute to elevated blood pressure. Yeah. So overthinking, stress, not having adequate sleep, and all those things can contribute to.
Before Kenny asks his next question, stop thinking too much.
So I was just about to build up on that to just tell you, our home viewers and listeners at home, that like Dr. Aminu Israeli said, overthinking is not so good enough. Like the people we always say, they say, "Well, I know they finish." Okay, so moving on, I think today our guests have actually been doing a very wonderful job towards dissecting what hypertension is. And so I want to go with Dr. Somto this time around. And I've got like 3-pronged questions for you. He has done 4-pronged for Dr. Aminu. So I'm going to do 3 prongs for you. While you're talking the other time, you spoke about checking the blood pressure, not picking just one single reading to get to get to the conclusion that a person is having high blood pressure. And so one of the first question also to ask is, how often should we check the blood pressure? The second one, I think I should take it one after the other. Is that correct?
You could ask. I'll try to remember.
Okay. So how often do we check the blood pressure? 2, what can we tag as a dangerously high blood pressure? Because I've been to a community where I checked the blood pressure of a woman, and the blood pressure was 210 over 100. And this woman was still very, very much active. So that is 2. The third one is people have been talking about supplements. The use of supplements to control blood pressure. How true is that? Does it really work? Dr. Somto.
So the first question is how often we should check our blood pressure. Well, I think it depends on a number of factors. But for an otherwise fit, young adult, it's recommended that the blood pressure is checked every 5 years, before 80. But after 80 years, they should check annually because of the fact that with older age, it's been considered a risk factor for hypertension. But then there are some other conditions, because like I said, an otherwise fit adult. So for someone who has an underlying condition which has a tendency, like Dr. Aminu mentioned, things like diabetes, high cholesterol and the rest, have risk factors for hypertension. So they should check it a lot more often than the person who is an otherwise fit adult checking every 5 years. And for some women who, while they were pregnant, they had high blood pressure, and they should check it annually as well, just to be sure it's within the normal limits. Hope that answers the first question.
Yeah. That's really puts more light on that, on the question. So the second one I ask is, what can we tag a dangerously high blood pressure?
Yeah, so hypertension is placed in stages. And there's stage 1, there's stage 2, there's stage 3. Stage 3 is considered severe, which is where the blood pressure is equal or greater than 180 over 120. So whichever is the high value, if it's the diastolic, which is the lower one, or the systolic, greater or equal to 180 over 120 is quite severe. At that case, something has to be done immediately.
Okay, so going to the last one, the last question.
It just occurred to me, and you said hypertension is when it's more than 140. The upper one is more than 140, and the lower one is more than 90. Yeah. That's when it's hypertension. But when it's more than 180 over 120, then that's very severe.
That's quite severe, equal or greater. Yeah.
Okay, thank you very much for that clarification. So now the last question I want to ask is, I've asked earlier.
Supplement question.
Supplement. Because a lot of people actually believe that supplements will help, but I want to find out if really that's how true that could actually be. if we use supplements, if you're having high blood pressure or having hypertension. Oh, I think I would say ask you a question later. Can we say high blood pressure and hypertension, are they the same thing? That is, you can answer that one in the other one I'm asking. So supplements, use of supplement, do you think it will definitely help people with hypertension?
Well, when it comes to supplement, there are so many of them. When it comes to food, there are some foods that has been found out to be good for blood pressure or bad for blood pressure. So bad for blood pressure are things that are rich in fatty foods, fast foods, foods that are rich in cholesterol, alcohol, salty meals. You see, so these are all some of the ones that are bad. When it comes to the ones that are good, we have things like fruits, we have vegetables. So when it comes to supplements, there are just too many of them, and that is why research has not really gone into them to say this supplement is good for your blood pressure. Which is why it's always good to go for the simpler, the cheaper means, which is fruits and vegetables, which have been found to be very healthy and good and keeps people healthy. So for your question, supplements, there has been no in-depth research to that. So it's just more of spending so much money for something you can get cheaper by just eating healthy and avoiding those meals that can trigger high blood pressure.
Thank you very much, Dr. Aminu. My next question is, and it's simple. Can hypertension be cured?
So, hypertension, yeah, it cannot be cured, but it can be controlled. And the reason why I said this is usually when people who have high blood pressure or have been diagnosed of having high blood pressure and they are started on medications, they tend to want to stop the medications when the blood pressure is normal, which is actually not the right thing to do. So, I mean, the blood pressure is just normal because your medications are controlling your blood pressure. So, it's not as if it's cured, but it's just being controlled. So, you have to continue taking the medications. You continue taking medications until, and you have, regular GP visits to monitor your blood pressure. The GP can adjust your medications to fit into what exactly your blood pressure is now, maybe by reducing the dose, depending on how or the outcome of your blood pressure control. But to put it straight, it's not curable. It can just be controlled.
Thank you. Dr. Somto, just a follow up to that. Kenny. Just a follow up to that. I understand that from what Dr. Aminu has said now, it cannot be cured, it can be controlled. So, two questions. The first question is, can it kill? That's the first question. If blood pressure is too high, can it kill? My second question is, I know someone who's been taking blood pressure drugs, and our problem is it's not getting as low as she wants. How low should it be? One. Secondly, if it's not getting low, what should she do? Because what usually happens is at home, she feels like the blood pressure, but once she seals that machine, she gets scared. So she doesn't want to check her blood pressure. And if she doesn't check her blood pressure, she won't know what her blood pressure is.
Okay, yeah. So hypertension can be fatal. It's like your
Fatal
heart
means
really life-threatening. Yes, it can be life-threatening. It's like the heart pumping so much with so much pressure on a narrow channel. The channels, which are your blood vessels, can burst in the brain, and it can lead to a stroke. It can lead to heart attacks. It can affect the kidneys. So it's a spiral effect when blood pressure is not controlled. Which is what brings me to the next question, which you talked about for the person who's checking the blood pressure and not sure of their targets. So there are certain targets that has been approved here in the United Kingdom. For the young person or the person of less than 80 years, a target of 140/90 is considered as a good target. While for people who are more than 80 years, 150/90 is considered as the target. So if your blood pressure is not within targets, there are medications that can help. And ultimately, with these medications, you can ask your doctors, your GP, or specialists who would then adjust. Some persons are on one medication, some are on more medications, as the case may be. And like we mentioned earlier, lifestyle plays a very significant role in controlling blood pressure.
Okay. Okay, thank you very much, Dr. Somto, for answering that question that way. It's a very explicit way of answering the question. I wanted to ask a question. Can we say that a person that is having high blood pressure is hypertensive, or can we say a person that is having hypertension is having high blood pressure? Either ways, which one is correct?
Yeah, all the same. So
Okay.
yeah.
Okay, thank you very much for that. And the next question I wanted to ask is, I've got a friend, Dr. Aminu. I've got a friend whose blood pressure who is over 40, and the blood pressure is in the 90s, 90 over 60, and this person is concerned. Is this supposed to be normal for him, or what do you think? Do you think he needs to seek medical attention?
Okay, so when someone's got blood pressure of about 90/60, if it could be the normal blood pressure for that person, especially if the person has no symptom to suggest possibly maybe the blood pressure is too low, and these symptoms are maybe the person is feeling dizzy, having fainting attacks or headaches or anything. I mean, if this might be the normal blood pressure for this person, so the person just needs to monitor the blood pressure, and if this is the repeated pattern of the blood pressure, most likely that's just the normal blood pressure for the person. The only time we are concerned is when the blood pressure is less than 90 systolic or less than 60 of the diastolic. That's when you're a bit worried. Even if the person is not having symptoms, there might be some lifestyle changes that you might need to introduce for this person to bring the blood pressure up a bit. But aside that, this might just be normal for your friend.
Okay. Still going further, you're actually in the renal unit. So can we say what effect, what impact those high blood pressure or hypertension, so to say, what impact do you think it has on our kidneys as human being?
So high blood pressure usually can damage the kidney, and then it can even be vice versa. So high blood pressure can cause problem to the kidneys, and at the same time, kidney problem can lead to hypertension. So if someone's kidney is exposed to high blood pressure for a very long time, it narrows the pipes that take blood to the kidney, and to some and after a long time, this might cause some changes in the kidney itself, and even in those vessels that supply the kidney. So with time, I mean, after some time, the person's kidney can just fail all of a sudden, and is actually a recognized cause of chronic kidney disease worldwide. It's a very common recognized cause of chronic kidney disease worldwide.
Thank you so much. We're beginning to run out of time, so I'm going to ask you three quick questions. Some of them are yes, no, so it's easy. So if I start with Dr. Sonto, once I start taking my tablets for antihypertensive, can I stop them?
No.
Okay, so it's going to be for life.
Well, it will require follow-ups, and then they could reduce the dose. And if you get to the point where you're within targets, you might just have it withheld for a short while.
Okay, that's my first question. My second question, because these are questions we've got from, we believe, our viewers and that we need to quickly look at. Are there activities I need to avoid if I have hypertension, Dr. Aminu?
Activities, I mean, most of the time it's just lifestyle modification that you need. And if you are talking about physical activity, exercise is actually good to control your blood pressure. But activities that you can engage in, like taking alcohol, smoking, and all those things, are things that you need to, cut down. But exercise is quite good. I can't think of any other activities that might, raise your blood pressure, except for maybe you are depriving yourself of sleep. It might actually affect your blood pressure. You are going through stressful periods. It might actually affect your blood pressure as well. So.
All right, thank you very much, Dr. Somto. This is coming to you. Is there supposed to be any linkage or any connection between hypertension and diabetes?
Yes, and it's a brother and sister relationship, if I would say, where there is a very strong bond. One can be a risk for the other can be a risk for the other. Most times it's diabetes, which is a major risk factor for hypertension because of its effects.
Okay, so taking the medication, hypertensive medication, maybe when you prescribe medication for patients, what time of the day do you think it's best for them to have the hypertensive medications?
Just take it whenever you believe you remember. Whatever time of the day where you will remember to take your medication, feel free to take it then.
Can I just add to that?
Okay.
So, I mean, at times as well, we need to counsel patients as well regarding medication, depending on the type they are taking. If you're on water tablets, for instance, you don't want to take your medication towards the end of the day because usually you are taking it twice a day. So usually I tell them take in the morning and possibly in the midday because this is going to cause you to keep going to the toilet to wee. And you don't want that to happen for someone that has got hypertension. You don't want them to be waking up several times at night. So that's the only time when you need to, adjust the time of the medication. But for other ones, you'll be fine.
Okay, let me just quickly ask this, Nii. I think it's a very important part of the question we need to ask. Hypertension and sexuality. I mean, talking about between husband and wife sexual intercourse. Does hypertension affect the way one of them actually performs? I don't know if you actually get what I'm trying to say. Because I've had a scenario where I've had a friend that discussed with me that because of the hypertension and some medication he's on, he couldn't actually have he has what they call erectile dysfunction. So how does that plays out? And if that is happening, what will be your advice for that person?
So as you mentioned, most of the time the relationship is medication. So in this kind of situation, the GP or the specialist has to change these medications for the patient. That's usually when there's no direct effect of blood pressure on sexual performance, but usually from the medication that the patient is taking. Then another thing is that for someone that has got high blood pressure that is not well controlled, doesn't know, it may actually cause problems during sexual intercourse. The person can actually develop a stroke during sexual intercourse because of the pressure on the blood vessels that are. There's someone that didn't even know they had high blood pressure or that is not controlled. So the person might develop. There's cases like that when they notice people develop stroke during sexual intercourse. So those are the only ways where these two things can be related.
I'm sorry, we actually out of time now. So what I'll do is I'd like you to give 30 seconds each to just round up. What will be your message for viewers at 30 seconds each?
I'll start by saying hypertension can be controlled, and a lot of it involves lifestyle modification. Maybe cut down on your salt intake. Maybe add some bit of exercise. Maybe reduce the fats, and then you could find that your blood pressure will be controlled.
Yeah, thank you. Just as my colleague has said, I'm not going to add much to what he has said. Hypertension is not a death sentence. If you are diagnosed with having high blood pressure, it can be well controlled through medications and lifestyle modification. For those that are not aware that they're hypertensive at the moment, you need to monitor your blood pressure as often as possible, especially if you've got family history or possibly if you have more than 40 years. It will be advisable to check your blood pressure as often as you can. Yeah, thanks.
Okay, so anyways, I don't know how to put it, but it's a very wonderful interactive session. So to say, I have to give it up to Dr. Somto Igboanogo. Thank you very much for coming to this interview, and also Dr. Aminu. Thank you also for coming up for this interview. I'm very sure a lot of people are actually blessed and are actually happy because you've been able to answer their questions, their pending questions in their heart that they've actually been looking for answers to. I'm very sure that you listening and looking at our viewers from home, you have already enjoyed this program. And so I will just implore you to just click on the subscribe button and also put in your comment if you have any questions. Dr. Somto and Dr. Aminu, a member of the JCC medical team, they will be more than willing to answer your questions under the comment section of the YouTube channel of RCCG JCC Wolverhampton, United Kingdom. And I'm very sure you will be looking forward to seeing and also waiting to have hot topics that we'll be talking about on this program. And like I said before when we started, it's the beginning of a new thing and a big thing, so to say. Nee, I think I should hand over to you now.
All right, so viewers at home, thank you so much for being part of the session. There are people that I have to thank. I have to thank David, who has been behind the camera.
Yeah, David has actually been doing a very amazing job.
I need to thank Mercy, who is part of our technical crew. I also need to thank Dr. Han, who's also part of our technical crew today. Thank you so much. I also need to thank the pastor, Pastor Joshua Kende, for this opportunity. Thank you so much. I need to thank the pastorate team too also for this opportunity. Thank you so much. Also for all members of the medical team, thank you for your support. We are grateful. If you're watching us, this is courtesy of the medical team of the Redeemed Christian Church of God Jubilee Christian Center. You can be part of our service. We meet every Sunday between 9:30 and 1 o'clock on every Sunday. And we also meet for Bible study versions online. You can be part of us. We're at 114 Spring Road in just in Wolverhampton here in United Kingdom.
Just to add little and just let them know that we have got postcode of WV46JT, and so that you don't miss the road. You're always going on point when you put in your postcode to know where you're going to. I feel like not leaving this state today, but if I don't go now, I have to just my wife will actually be talking at home, and so we'll not. If I don't go now, we'll not come some other time. So
All right, so till next time while we come your way, this is Olani Ifayemi saying thank you for being part of us. Thank you.
and my name is Kende Oshinde. Just stay tuned and don't forget to subscribe to the channel, to YouTube channel, so that you can always get the notifications once we upload a video. Thank you very much, and see you some other time.
Thank you. Bye-bye.